This slide presentation is on drugs for erectile dysfunction and BPH. Erectile dysfunction is known as impotence. It's persistent inability to achieve or sustain an erection suitable for sexual intercourse. It affects up to 30 million men, commonly associated with chronic illness such as diabetes. Risk for ED increases with advancing age. Drugs used to treat ED include your oral agents, which are your phosphodiesterase type 5 inhibitors, such as Viagra, and your non-oral agents, such as your Pavarin, which is the injection. You have your psychotherapy, and then surgical implantation. First, we'll talk about Viagra. It is the first oral agent for ED. It was introduced in 1998. Generally well tolerated, but is dangerous if it's given with certain vasodilators or nitrates. The effect was discovered by accident because it was being developed as a cardiac medication, and they saw the side effect for it. So that's always an interesting little tidbit to tell the patient. It only enhances normal erectile response in the presence of stimuli. So it doesn't affect men who do not have ED. It is not approved for women. Adverse effects, so you can have hypotension, priapism, you can have headache, dyspepsia, flushing, nasal congestion, diarrhea, rash. You see the rest here. Rare side effects, you can have a non-arteritic ischemic optic neuropathy or sudden hearing loss. I've also heard that sometimes the men see blue, kind of a blue tint to everything with the pill. Absorption is slowed by a high-fat meal, so tell the male that they should not eat that big steak before. That won't be a good thing. Drug interactions include, of course, the nitrates, which can be life-threatening, and it should be 24 hours between the medications. Alpha blockers can cause a postural hypotension, and other drugs that are inhibitors of the 3A4 cytochrome. So it could suppress metabolism of the Viagra. The drug should be used with caution with men with the following that have had an MI or stroke or life-threatening dysrhythmias. If they have resting hypotension, resting hypertension, heart failure, or unstable angina. It shouldn't be used by men that are taking nitroglycerin. So this, the first one there is Levitra. It's similar to Viagra. What's unique for it is that it can cause prolongation of the QT interval. Your Cialis is unique in that it lasts for 36 hours. I'm sure you've seen those commercials to that effect. And the last is Stendra, and it's unique in that it has the fastest onset of action. So Levitra relaxes the arterial and the smooth muscle in the penis. It adverse effects, headaches, rhinitis. That prolongation of the QT interval can lower blood pressure, and it can be associated with the serious side effects mentioned earlier. Your Cialis, you have to watch the nitrates, of course, and the alpha blockers. Okay. And Cialis also relaxes the smooth muscle. It can last up to 36 hours, so it's the longest lasting. but is now approved for daily use um, if activity is anticipated at least twice a week. Same adverse reactions and same drug reactions as Viagra. The Stendra begins to be effective in about 15 minutes after dosing and lasts up to 2 hours with the same adverse effects and drug interactions. There's a prostaglandin E1 that can also be used. It's injected into the corpus cavernosum of the penis, increases arterial flow and decreases the venous outflow. It should not be used for more than 3 times a week or once in 24 hours. And the side effect profile is listed here. One of the main ones is a prolonged erection, priapism. You can also have an injection with the paparin, and it does the same as increasing arterial flow, decreasing venous flow. It is also injected in the same side effect profile. Okay, next we're going to talk about BPH. It is a non-malignant prostate enlargement. It's caused by excessive growth of the epithelial cells. Signs and symptoms: urinary hesitancy, urgency, frequency, dysuria, and nocturia. You can have straining to void, post-void dribbling, decreased force and caliber, and it's a sensation of incomplete bladder emptying. Treatment can be surgery, watchful waiting, drug therapy with the 5-alpha reductase inhibitors. And then alpha adrenergic antagonist. So the first would be your Proscar. It's effective in patients with a very large prostate, so that they're having now mechanical obstruction. Also sold at lower doses as Propecia for male pattern baldness, so that's interesting. And adverse effects: it decreases the ejaculate volume and libido. It can cause gynecomastia, and it decreases the levels of your PSA. You have Avodart, which is similar, but with 3 differences: is that it reduces the DHT and is more complete in doing so. It's harmful to the developing male fetus, and it's extremely long half-life of 5 weeks. You have your alpha 1 adrenergic antagonist, and 4 approved for use, and they are listed here along with a couple others that aren't at the end. They block the alpha 1 receptors, relaxing smooth muscle in the bladder neck. So these drugs have an impact on blood pressure, so that they either have an effect, they're selective for the alpha 1 receptors in the prostate, but they can also block the alpha receptors in the blood vessels, and they promote vasodilation and can lower blood pressure. So the adverse effects for these drugs can be, they're less likely to cause effects the Flomax and the Uroactral. The Flomax can cause an abnormal ejaculation now. The Hitrin and the Cardura can cause a hypotension, fainting, dizziness, somnolence, and nasal congestion. But these drugs do not decrease PSA levels. Interactions: exercise with caution with other drugs that lower blood pressure. You have to, and there's interactions with the nitrates, with other antihypertensive drugs, with drugs used for ED, any inhibitors of 3A4, and if the patient has cataract surgery, they can end up with floppy iris syndrome. These, if they're used in women, um, they, for urinary hesitancy or urinary retention associated with bladder outlet obstruction or insufficient contraction of the bladder destrusor muscles. It relaxes smooth muscle in the bladder, neck, and urethra and provides maximal improvement, which may take several weeks to develop. Other drugs for BPH include saw palmetto, which is used widely, and it is effective, but there's not a lot of evidence to support it. You have Detrol, and then you can use the botulinum toxin, which can also help. So questions here. First question, patient is prescribed Viagra for erectile dysfunction. Which instruction should the nurse include in teaching? And that is C, to avoid the nitroglycerin with this drug. Remember, you should have a 24-hour gap. Patient is taking Proscar for benign prostate hypertrophy. The nurse should explain that this medication has what effect? And the answer is A. It decreases the size of the prostate gland, and not all the drugs used for BPH do that. In question 3, the nurse should instruct a patient prescribed Viagra to avoid taking this medication with what? And the answer is A, grapefruit juice. As we've learned from previous weeks, you should just tell your patient don't drink grapefruit juice because there's just so many meds that it can interact with. And that's this presentation. Thank you very much.